Good evening. My name is Teresa Turner, and my Nursing 442 Nurse Case Management presentation is on diabetes. The description of the patient and her chronic illness is as follows. Her name is MS. She's an 85-year-old African-American widow. She's female, of course. She's a retired school teacher, widow, and who lives alone. She does have a daughter that lives a couple blocks away and checks up on her every day, who helps Mary manage Mrs. S, I should say, manage her medications and brings her groceries. She has Medicare Part A, B, C, and D, which are managed by her HMO, Kaiser Permanente. She has type 2 diabetes, which was diagnosed 2 years ago, and she currently takes metformin, 1,000 milligrams, twice a day at breakfast and dinner. She has been living alone, self-monitoring her blood glucose, and she has interval hemoglobin A1C blood draws. She's on a low-sugar carbohydrate diet, and her primary care physician recommends that she exercises daily. She's recently hospitalized for uncontrolled diabetes with an episode of hypoglycemia that caused severe dizziness, rapid heartbeat, sweating, and tingling of the face and lips. The clinical judgment that I have of comparing her self-care capacity with her chronic illness and treatment demands are Mrs. S, I can say this much, is an articulate, college-educated woman, and she is capable of living independently. She is at risk for ineffective management of therapeutic roles at home of her diabetes due to the lack of knowledge about her condition. A priority patient issue for Ms. S is discharge planning. For discharge planning, which would be, it's recommended that she is provided diabetes self-management education and support, and maintain her blood glucose levels between 80 and 130. She will also need some help with meal planning and medications. Her clinical judgment of where she can be discharged, she has very good judgment. My clinical judgment of her is that she could be discharged on her own to her home. She does, like I had mentioned before, has a daughter that lives close by, and they are available to help with her care. Also, it's going to be discussed that maybe they can consider some home health that can be scheduled to follow up with her or to assist with her diabetes self-management. The priority nurse case management strategies under the patient level. She would definitely need to be the nurse case strategy that I would use would be education using the teach back model. We know that when we use the teach back repeat model, we check the understanding, explore her thoughts and willingness to apply the concepts. Also, the family, herself and the family, will need coaching. And also we want to empower her to be able to make these changes and to do her self-care. At the system level, we want to coordinate with her managed care, which is Kaiser. We want to get together and talk to her primary care physician. And we also want to set her up at the diabetes clinic, and again, with maybe some home health that could come and help and with managing some follow-up or any if they can see any issues that Mary might be having, they can do some more teach back and reinforcing. An intervention for her at her patient level, and the nurse case management strategy would be the partnership approach. We'd want to set up a meeting with her family, and we want to discuss the support for meals and blood glucose monitoring. We also want to discuss and do some education on diabetes self-management. And also we want to assess, again, for the home health needs. She may have issues with her ADLs and her IADLs. Maybe she has none at all, but because mostly she doesn't have any issues with those things, but there could be some things that she may want to have a little bit more help with. And so we know that when we do this, that education and collaborative decision making and empowerment, those are all the things that are going to help Mrs. S to manage her health needs. So, like I said, she may want to have some home health nurse come and help her with her care, or she may just need it once in a while. An intervention for her at the system level. The strategies that I picked for her would be maybe some like clinical consulting with her primary care physician. We want to evaluate her current medication regimen. She may need to change the metformin to be a little less or maybe a little more. She may need to supplement with certain insulins, maybe some short acting or long acting, whatever her primary care physician feels might be best. But again, we can have home health set up. We can coordinate with Kaiser Permanente, work with a multidisciplinary team, and we could have home health come and maybe assess those things and see where she's falling with those. And again, the diabetes education classes that she can get at Kaiser. Kaiser is a very good resources for their patients. And there's diabetes clinics she can go to on an outpatient. And also, they also have excellent resources for if she wants to join exercise to help her be flexible, and also if she's having any issues with weight management. As far as utilization review is concerned, we want to plan for a smooth transition to home by identifying multiple comorbidity issues. She may have other issues that might develop. So far, she doesn't have any hypertension or any type of dementia or anything like that, but there could be some. So we want to explore those a little further with the multidisciplinary team. And we want to coordinate with some outpatient healthcare professionals if it's needed. We also want to identify insurance coverage for supplies, equipment, and medications. And we also, let's say there's some things that she really needs or she really wants that Kaiser can't help her with, then we want to seek alternative funding if insurance coverage isn't available for some of the things that she may need. We want to evaluate her coverage and see what she does qualify for as far as home health is concerned. And we also want to continue to support her care post-discharge after she's out of the hospital. Some quality and safety issues are, we really need to help her understand and evaluate her levels of A1C and her blood glucose levels. And we need her to understand the risks of not maintaining them in their proper ranges. We know that diabetes is a disease process that may change from day to day due to changes in lifestyle and other illnesses. And so if she has to take other medications or do some other changes, it will affect her diabetes process. We need to be prepared to make adjustments and problem solve rapidly. We need to avoid hypoglycemia. Her recent incident got her in the hospital because she became very dizzy. She had all those symptoms of hypoglycemia, and it was so bad that the paramedics were called, and she was had to be admitted. So we need her to understand that confusion, heart palpitations, shakiness, anxiety, her whole body could be affected. excess sweating, excessive hunger, fainting, fatigue, lightheadedness, shakiness, nausea, vomiting, some mental confusion, unresponsiveness, dryness, tingling lips, and then also a lot of other common things is anxiety, blurred vision, headache, irritability, pallor, palpitations, sensation of pins and needles like she had, sleepiness, slurred speech, tremor, or unsteadiness. So we need her to really understand her balance between her diet and her hypoglycemic medications. And if insulin is introduced, we need her to understand all the effects of insulin. And also, we need to, especially if insulin is introduced, we need her to understand the problems with hyperglycemia. And so that's another factor that she really needs to be educated on. And it's our job as case managers is to make sure that some of these safety issues are addressed so that she can have the quality of care that she needs when she's out of the hospital. As far as the nurse case management effectiveness at the patient level, we know that when there's a behavior change, that's the unique outcome measurement for diabetes self-management education. When we see that a patient is following everything exactly and they understand the process behind it, and there is a definite behavior change, we know that our strategies are effective. We also know that the 7 diabetes self-care behavior measures also determine the effectiveness of whether the diabetes self-management education is going to actually work. So we deal with it at the individual level and how well they're participating with it, and population levels. Also, diabetes self-care behavior should be evaluated at a baseline. So we start out to see how she's doing, and then at regular intervals after we put them in the education program. And usually diabetes education programs do help monitor this. Let's see, the effectiveness of our nurse case management strategies at the system level. Well, we know that the continuum of outcomes, including learning, behavioral, clinical, and health status, should be assessed to demonstrate the interrelationship between diabetes self-management education and behavior change in the care of individuals with diabetes. So we know this. However, individual patient outcomes are used to guide the intervention and improve care for that patient. So population outcomes are used to guide the programmatic services and for continuous quality improvement activities for the diabetes self-management education and the population it serves. So we look at these things at the system level based on the outcomes. Because we have to understand that there must be a balance between real world situations and the ideal clinical circumstances that allow Mrs. S to manage her diabetes. So it's essential to always be reevaluating and assessing and to discuss all the aspects of care openly and then repeat care issues at every possible opportunity so that she can maintain her diabetes and she doesn't end up in the hospital with an uncontrolled diabetes risk. And that's basically her risk. And that is the end of my presentation. Thank you very much. Okay, so did I actually